For me, it's really about breaking down that wall and then being open and honest with us and us being open and honest with them.
I started as a Med Surg tele nurse, and so I'm a true advocate of new nurses starting, getting that foundation as a Med Surg tele, and then, of course, moving onward or upward, staying within our unit to the critical care, or then going to other areas. But to get that foundation on our unit has been really critical, and really positive feedback from nurses who've moved on. Of course, we always want them to stay, but if they want to move on to different areas, they have a good foundation of organizational skills.
So I would say take a deep breath. It's going to be okay. We are just trying to get to know each other during the interview to see if it's going to be a best fit for us, as well as just as much as it's going to be a best fit for you. Take your time in answering the questions. If you need to take a moment, that's fine. And just be open, honest, and transparent.
Other things that would impress me is someone who might bring a notebook, be taking notes during the interview, have some questions prepared for the hiring manager that they want to know about the organization. One thing that would impress me is if a new graduate asked if this organization had magnet status and how many times they had been recognized as a magnet organization. Those things would impress me. Hiring managers are looking for someone who can think critically through the interview process by answering questions that may throw you off a little bit. I think they're looking for someone who can make a personal connection through eye contact, through smiling, through being relatable to people. Those are the things that I look for as a hiring manager and the people that I want to work for me.
Yeah, so I think the biggest piece of advice that I can offer to somebody who is getting ready for an interview is, I realize that interviews can be very stressful and anxiety provoking, but try to be as comfortable as possible.
I think what impresses me the most is new grads, even new hires that are proactive. They're proactive about learning. They're willing to ask questions.
Hiring managers look for somebody who's very passionate about the job, especially in a nursing career. Somebody that's very compassionate. Somebody who's also eager to learn. We know that this is very gratifying job and you're gonna encounter a lot of challenges along the way, but somebody would really stand out if it's very open-minded and eager to learn, and on top of that is very compassionate about nursing.
I'm impressed with the knowledge that the new grads are bringing into these programs. I see that they really have a solid foundational knowledge, and they're missing the clinical aspect, but that's okay. What I do see is the knowledge that they have and what they bring. They're bringing all the stuff that they had from nursing school, and they're connecting the dots.
It's probably a good idea that they have some experience in a hospital outside of school. So that could be volunteering, that could be working as a nurse's aide, it could even be working in more of an office setting in a hospital, but something that gets their feet in the door of a hospital. If they are really interested in a specific area in nursing and they've gone out of their way to work in that area as a student, to volunteer in that area, to join an organization, those are really impressive. Those are very impressive.
I think the way that we can really kind of have a successful interview is to be able to really speak to and talk to one another, and I may ask you to elaborate. So if I do feel like it's kind of those typical answers that anyone would expect, that's why I would really take in consideration of thinking about specific examples from your past. It could be even from school. It can be any time during your work experience, but come with examples because we may build off of that throughout the interview process.
I like that they are, well-groomed, and I like that they smile. I like that they are prepared, and I don't like a candidate that is late for the interview or when they are coming dressed up like not professional.
Yeah, so in Med Surg, the candidates that we are looking for really have a passion for teaching because our patients are really ready for that next level of care, whether it is home, rehab, or wherever the case may be. So lots of teaching opportunities with our patient population and really getting the patient engaged in their care as well as their family members as well, because their family may also be the one providing care for them once they are at home.
The specific qualifications that I hire, especially on my units, are they have at least surgical background. They took care of surgical patients in the past. But for new grads, they don't need to have surgical background, but they're always willing to work with post-surgical patients.
Thanks for watching. To get full access to our Simple Nursing New Grad Prep course filled with tons of helpful tips and tricks, simply click the link in our description below. Remember, don't be scared, be prepared. Ensure a smooth transition into your nursing career with our new course. See you guys there.